The significance of sensory integrity findings, especially in this case, is to get a sense of the patient's ability to feel the environment around them. This is necessary for ambulation, for establishing balance. Now, this patient had some poor sensory integrity findings because his sense of touch in his lower extremities was kind of lacking. This can lead to deficits in balance and ambulation. If you can't feel the surface below you that you're ambulating on, you're going to have a hard time establishing basis support and knowing how to ambulate, because you don't even know what type of surface you're walking on unless you're looking down, and no one wants to look down while they're walking. As far as the functional reach test, that's pretty self-explanatory. So it's basically just keeping your feet planted forward, and as you move forward, you're supposed to reach as far as you can without unplanting your feet. Now, Andrew's score was 5 inches. This is quite the deficit, as the average within his age group of 70 to 87 years old is about 13.2 inches. So we definitely want to address that. The next functionality test was the Balancberg scale test. Now, this is actually a compilation of many tests that address static and dynamic balance. So it can be sit to stands, kind of turning and reaching tests, as well as ambulation tests. And all of these tests over time compile to a total score. The higher the better. 0 to 20 means that you probably need a wheelchair to ambulate around. 21 to 40 means you're a high fall risk and you will probably need some sort of assistive device to function perfectly in society. 41 to 56 means you are low fall risk. Now, Andrew's score is actually a 41. He's kind of teetering between low fall risk and high fall risk, so we got him at the right time to provide some interventions to keep him as a low fall risk. The timed up and go test, also pretty self-explanatory. It's where you're sitting down, and when you're told to go, you go and you ambulate to a certain goal. It can be like a disc directly ahead. You turn around and then you sit back down. Now, Andrew's age group scores this in about 10 seconds. It took him about 22 seconds to do this, so his sense of ambulation is definitely going to need to be addressed. I came up with some interventions that might help address these needs and to reach his wanted goals as well as the goals of the plan of care. So I started with some bridges, 3 sets of 10 with a 3-minute rest, and we can use this to improve his stability, improve his lower leg strength. We're trying to get that back to a 4+ from the 4 he's at. And in addition, we can progress this to going from a stable surface that he does these bridges on to a yoga ball. This provides the balance aspect of it, and we can also improve his balance and provide a little bit more of a challenge for him. My next activity would be sit to stands. Now, this would directly help with his timed up and go test, as that is part of it. This can also be, quite the aerobic activity for someone at his age of 76. It can also improve his lower leg strength and his endurance as he does that. We can progress this to bringing it to 12 repetitions, lower the rest from his usual 3-minute rest that I originally set it out to about 2 minutes of rest. My next intervention would be actually a step and reach exercise. So I'd have him stand up, I'd widen his base of support as he steps forward and reaches. Because he's widening his base of support, it's a little easier than the, functional balance test. So I will have him start at that 5 inches that he was doing without stepping forward. And with that wider base of support, get him to do 10, to do 15 inches over time. And then over time, that can improve his actual test score. Next, I would do some gait training. So I would actually simulate the timed up and go test. I would have him get up and do it for 45 seconds as far as he can. I'd have a chair handy in case he needed to sit. And we would do this twice for 45 seconds. When I ran track, when we were taught to run 3-4 miles for competition. They wanted us to run 6 miles, wanted us to do twice as much as our event. So that properly trained us for what we actually had to do. And I want to simulate that with this patient. So as his test was 22 seconds, we double that, just do as much as he can until he grows more tolerant. Over time, the test will improve. I would want to progress him to doing 3 total laps once it gets less challenging. As for my last intervention, I'd have him do a high step and reach. So I'd have his hands forward as he marches his knees up, and we can improve or increase the parameters by having him do this as he does each knee up, which would improve balance and coordination. We can track improvement through faster ambulation skills, greater balance, and better sense of coordination during gait.